doing. So we are going to immobilize this fracture. Are you seeing? So, are you observant?
Yeah.
Do you know why we are taking this through these points, these places? We don't want to lift this leg because it is already affected, and we have to use these natural openings. You fix it there, then slowly pull it to where you want it. Have you seen? Then we shall fix one of the splints down here very slowly. Have you seen?
Have you lifted like?
So don't lift somebody's what? Leg. So
But you're in gloves, eh?
you should be in gloves. Now, with the fractures, we have what we call a compound fracture and a simple fracture. So with a simple fracture, it is called a closed what? Fracture. It breaks from inside and the skin is not affected. Okay? So you may know the location of the fracture, or you may not, depending. Or maybe you will see it through a swelling. But there are situations where the fracture is complicated. The compound one, where it comes out, where the skin is affected. The skin is torn. Sometimes the bone comes out or protrudes. Okay? So you have to deal with the dressing and all that. So you deal with the dressing first. So you will clean the area if need be, then cover the affected part with a pad. And even in a snake bite, we shall keep washing away the what? The venom. Then we cover and tie. So this dressing will keep sucking the discharge. You remember yesterday the use of? Then we shall be able to tie this. Remember leftover? Why do we apply the knot directly on the dressing? Who remembers what we said about the knot here? It applies direct pressure on this dressing, which dressing also exerts pressure on the wound to control bleeding. So now we have dressed the affected part, okay? And we now want to remember to use to apply a lot of pads at the bone areas. These are bone areas. If I put here this splint and even this part, this person will feel uncomfortable. It will be painful. Is it clear? So what you do, if you have enough of this, you do this. For us, we have enough, we shall do it. But if you don't have, you can improvise. You can get one fixed inside here so that it can help you here and there. You get it? So you just have to use your logic. So remember to reassure. Reassurance is very, very important. It is psychological treatment. Is it clear? So now,
learn how onto the speed.
next time,
Next time, I'll leave you.
Are we there?
Yeah.
So when you tie firmly but not
Tight.
tight. So we don't want to cut off blood circulation. So it will be firm enough but not tight. Are we there? So if it was a snake bite, you remember when we talked about a snake bite? Now, you immobilize the affected part. The snake has bitten this part. So you immobilize like that to limit the movement of this leg. Because when he's crying and suffering from the pain, he will be moving this leg all the time and all that. He will be restless, in other words. So to avoid that, you immobilize. When you immobilize using splints, you will limit the movement of the affected part. Then you will refer this casualty. Okay? You will move with this casualty to the nearest health center. Always refer the casualty to the nearest health center. They give some treatment, and if they can't handle, they will always refer you. But for you, you refer to the nearest health center. Then you can communicate to the relatives and the rest of the people. Is it clear?
Yes.
Uh-huh.